Good morning, this is Dr. Hartley, Hartley Chiropractic in Scoliosis Center, and today I have Megan with me and we're helping her with her fifth delivery, and we're going to show you how we work on pregnant women, how it really helps with the delivery, helps with less pain during delivery, and also usually you have a shorter labor time. So go ahead and slide back on your back for me. And first thing we're going to do is check Megan's leg length, and hers is looking good today. Turn to your side and come on up. And then she's going to go on her stomach. We're going to drop this away. This is a special table. It allows the baby to come in here. Go ahead and go with your hips over the blocks, Megan. So as the pregnancy goes along, women don't tend to lay on their stomach. It's very uncomfortable. So for one thing, this position is very comfortable, that they can get a chance to lay in this position. So we do the pelvic adjusting and the mid-back adjusting, some of the neck adjusting, all in this position, makes it a little more comfortable. So pregnant women look forward to getting that adjustment in that position. Now we're going to do a pelvic adjustment. We're using the drop table was the first adjustment that I showed you. Now we're using the Arthur stem. It's a very specific adjustment based on the x-rays. We have in between Megan's pregnancies, we've done x-rays of her spine, and we're doing a very specific adjustment based on those x-rays. The ribs can get very misaligned during a pregnancy. This is called a rib adapter, and it allows us to do a very specific adjustment on the ribs, especially the lower ribs around T11, T12 can really get locked up during the pregnancy. And go ahead and stand up for me, Megan. And we're going to do what's called a cervical chair adjustment now on Megan. And the very upper neck, go ahead and sit here facing that way, influences the occiput C1, C2 area, influences a nerve called the vagus nerve that comes out between the occiput and C1, and that has a big influence on the uterus. So it's very important for that to be working right. And on Megan, I can feel she has a left C1 misalignment or atlas and a right occiput. So we're going to adjust her in the chair for that. Great, that's better. Okay, now you're going to sit here facing that way for me. And now, based on her x-ray, we're going to do some very specific adjustments on her neck. This upper neck, again, has a big influence on the uterus, the vagus nerve. It's called the wander. It travels from the upper neck down through the heart, lungs, all your digesting organs, ovaries, including the uterus, and it has the parasympathetic nerve control for those areas. Tuck your chin down. Now we're working on bringing the cervical curve in the neck. And as I've talked about on other pregnancy videos, it's very important to work on your posture when you're pregnant, because as that pregnancy goes along and you get bigger, and this goes forward, you end up like this. And if you have multiple pregnancies, the posture just gets worse and worse and worse. So you can end up having a lot of issues as you get older. Go ahead and slide back on your back for me. Okay, so we're going to check the iliopsoas. So there's some muscles in here that can get very tense during pregnancy, and that tension can be indication of tension on the round ligament and the inguinal ligament. And so when we make sure those trigger points are freed up, it gives the baby a chance to move around. And it's just a light finger pressure. When we feel the tension there, we just hold pressure until the pressure relaxes. That's good. And on Megan, we also are working on her esophagus. If you get the diaphragm right here, there's a valve that separates the stomach and the esophagus. And if the stomach goes up through that, you can get a lot of digestion issues up in here, okay? Kind of like acid reflux. So this is a light adjustment that helps with that. She's gonna breathe out. Big breath in, out, big breath in. And that just helps to traction that stomach back through the diaphragm and prevents that acid reflux. And a lot of pregnant women will get that. So we're gonna check the leg length one more time. Good, okay. Turn to your side and come on up. All right, thank you very much, Megan.
Thank you.
You guys have a great day.